regarding the presentation of Ayurveda medicine information in the websites and in lot of journals, in lot of Ayurveda magazines, many of the Ayurveda medicines in YouTube channels. We also run a YouTube channel in which we also share Ayurveda medicine information. So I had got a comment that should we really be doing that? Should the patient know all the ingredient list? And should the patient or the general public should be knowing how to use it, what is the actual dose? And will it not? So if we publish all the contents and ingredients, uses, dose, etc. of Ayurveda medicines, will it encourage self-medication? So of course, when we publish anything, we put a blank disclaimer that this is just for information or education's sake. But still, how good or how bad it is? Dr. Gurata sir, kindly share your valuable thoughts on this.
So it's a basic right of a patient to know the contents and ingredients of any medicine. And I don't mind that he should not be, made aware of these things. Once a website or something authentic source or information giving a valuable information about the drug, the combination and dosage and everything, patient on the other hand has a faith increased on his or her doctor when she reads or he reads these websites or anything information or a source which matches with what his prescribing doctor has said. Definitely it will going to boost the morale of the patient. Point number one. Then point number two is there are a lot of information regarding the dosage and everything. It is a general dosage format. It doesn't fit to each and every individual. Each and every individual has to be prescribed the dosage and everything by a consulting physician. A consulting physician has to take care of that part, and that cannot be stress passed by the patient to go for a self medication. Self medication with any medication is always dangerous because you are not well aware of the facts about the medicines and their side effects, their combinations, dosage and many other facts. So it should be very, very careful while going for this. It is just for the sake of information that whether my prescribing doctor has given me, for what reason he has prescribed these drug to me, these things to be known to a patient. And once the patient knows about these things, then his confidence in the medicine as well as in the doctor will increase. So for that purpose, and also to enhance the knowledge, because many times even the Western allopathic or other medicines also, there are a lot of information available on the net. So anybody can read. Similarly, for the Ayurveda also, if it is there, it is well and good. It should be a ready reference because not always you can go and consult a book. If it is available in a soft format in a media, internet or something like that, it will be very handy for many a times, even for the even prescribing doctor for a brush up or even for a ready reference or some sort of remembrance what he has forgotten or maybe update himself for many, many reasons. This is always a positive thing. And from the point of patient, self-medication is always dangerous. You are not a prescribed or a qualified in that. You need to just to understand those medicines and your doctor is the right person to fix the dosage for the medicines. So that is the one point. Number two, we need to understand. And moreover, I don't think so it will promote for the self-medication. Nobody will dare to take an unknown drug without the prescription. It's not a OTC, over-the-counter product. It is a prescribed scheduled drugs. Nobody will going to take it like that. Everybody are nowadays health conscious. They will take a lot of precautions. They will consult the doctor and they will take it. And it won't, in any way, it won't promote the self-medication. And even our intention of publishing those things on the net is also not to promote for the self-medication. Self-medication is always a dangerous one because we don't know the exact the combination and the exact dosage which is suitable to that person. So that's the reason we should be very careful in that part of it. So otherwise, publishing the details of each and every ingredients and how they behave and what the textual references given and what they are doing and latest researches connected to that, everything if it is available on the net, there is no harm in it. That will just boost the information. as well as the morale of the patient.